You can't tell from this perfect crow position, but Camille Petrillo spent more than a decade nearly paralyzed by pain. Her spine partially fused, both hips replaced.
I suffer incredible pain, chronic pain. I did opiates. I was dwindled down to 80 pounds.
10 different prescriptions still didn't help her pain and loss of sleep. Then she found marijuana.
Medical marijuana is a lifesaver for me.
She's ditched the pills and now vapes cannabis.
I'd say average of 4 vapes a day.
Chronic pain, PTSD, and now opiate usage are the newest ailments New York State has approved for cannabis medicine. Nearly 60,000 patients are using it, with 1,700 docs doling out prescriptions. Dr. Daniel O'Connell is one of them, working in a whole new way with a virtual visit, handing out prescriptions for medical marijuana to patients who never come to his office.
In 2004, my battalion, or lots of battalions, we went into Fallujah.
And Corporal Todd Rogers found himself still fighting battles once he came home.
The chronic pain, the headaches, and also the PTSD.
Rogers is a typical telemedicine patient for Dr. O'Connell. Uploading his medical file electronically, the doctor sets up a secure video conference, then mails off the card for him to fill his prescription.
Medical marijuana as a safer alternative to opioids in order to help combat this very serious crisis.
According to New York's Health Department, medical marijuana cuts the amount of opiates needed for pain and saves lives. States with medical marijuana programs are seeing 25% fewer deaths due to opioid overdose. Patients like Rogers can go to any one of 10 dispensaries in New York to fill a pot prescription, choosing from pens, drops, gels, and it's a booming business. MedMen, with its splashy 10,000 square foot place on Tony Fifth Avenue, is well positioned when and if recreational pot goes legal.
A record number of Americans now support legalizing marijuana, and every time a new poll comes out, it shows that the numbers are higher and higher.
Dr. Junella Chin has been prescribing for more than a decade on both coasts, finding her patients cut their opiate use for pain dramatically.
It's huge. The data is there. Medical cannabis is helping patients with the withdrawal symptoms. So normally I have patients taper off the opiate medication, or they would end up using less dosage and less frequency in conjunction with the medical cannabis.
So let's talk about a major obstacle, cost, where you can get opiates as a prescription medicine covered by your insurance company. Medicinal marijuana is all paid out of pocket. This is still part of that state versus federal law issue. While states have legalized it, the federal government has not, which means users are forced to spend hundreds of dollars every month for this type of medicine.